Hello everyone, I'm Crystal Rivera, a nursing student at the University of Buffalo. My change project consists of a nursing handoff and the importance of shift-to-shift report process. The aim of this project is to increase communication and team functioning by implementing a mandatory change of shift nursing handoff to the nightly nursing grounds staff. Currently, we have a nursing grounds that's used as an on-call for staff in the home of individuals with developmental disabilities. If any concerns arise, staff are to call nursing grounds, and nursing grounds gives directives for medical treatment. The house RN goes off duty at 4 p.m., so there's no communication handed off to nursing grounds as to the current health status of the patients at the end of each shift. During off hours and weekends, nursing grounds does send an end of night report through email to the entire team. Here is some evidence supporting my change process. A nursing handoff shift to shift report is very important and it also leads to increased safety within an organization. According to the Agency of Healthcare Research and Quality 2017, nurse shift changes require the successful transfer of information between nurses to prevent adverse events and medical errors. Patients and families can play a role to make sure these transitions and care are safe and effective. Strategy 3 Nurse Bedside Shift Report helps ensure the safe handoff of care between nurses by involving the patient and family. Liam and Pajarello 2016 explain that effective change of shift handoff communication is a core competency in the generalist education of nurses. The use of a standardized handoff tool that fosters higher order thinking and clinical reasoning is fundamental in clinical education and nursing practice. Also, an article in the Minority Nurse of 2015 states communication breakdown is a leading cause of medical errors such as gaps in healthcare, incomplete and missing information, and medication errors. Most importantly, communication supports the foundation of patient care, so handoff reporting during shift change is a critical process that is crucial in protecting a patient's safety. Throughout the handoff report, it is vital to provide accurate, up-to-date, and pertinent information to the oncoming nurse. Not only are nurses transferring responsibility, but we are also shepherding and ensuring a safe passage. Providing a handoff report to the next shift, which includes nursing grounds, will give nursing grounds a better idea of the status of the patient prior to them coming onto the shift. An expected outcome includes improved patient outcomes, improved individual quality of life, improved team function and communication. Currently, nursing grounds does not have a baseline as to how these patients were before they came in, so this would help them. Steps to Steps to obtain report for nursing grounds. Step number 1. The RN is responsible for obtaining a detailed assessment on the patient of concern. Step 2. Assessment of the patient is done when the RN is called or notified of a concern or change of patient health status. Step 3. Assessment is performed at the bedside by the RN. Step 4. Collaboration is done with the treatment team leader, house staff, nursing grounds, nursing administrators, and residential day habs. All of the above individuals currently contact RNs with concerns. Step 5. A report sheet will be filled out and sent via email or fax to the mentioned team members above. Expected outcomes. When change steps are implemented, staff now have a baseline as to the current health status of the individual of concern. Nursing grounds will have a clear idea of what is going on and any current worsening symptoms to compare the nurse's prior assessment. This will indicate any changes. Steps for the next line of care can be determined with a support from the assessment that was done visually as opposed through a single telephone triage. Any changes can be applied as needed in an SBAR format. The system will include lines for a head-to-toe assessment. Any medications that were given, PRN medications for interventions can be included. Nursing directives can also be implemented in a box on this form. Directives given by the RN can also be included. And if the MD was contacted or an ER or urgent care visit was indicated. What actually happened? My proposal was given to my treatment team leader. Methods for a document that can be used across the agency are still being researched. State regulations are in place for the facility that I work for, and any changes need to be approved through Albany. The agency likes the idea and is going to implement change into the current nursing routine. References for the articles and the slides are included here, and on the next slide you'll have a peer review rubric.